Prevalence of liver disorders in India. Liver diseases are being recognized as a public health priority in India, contributing to 20.1% of the 2 million global liver disease-related deaths in 2021, accounting for 1 to 1.9% of deaths, with over 52 million people infected with chronic hepatitis in our country, reported as per the Global Policy Report on Prevention and Control of Viral Hepatitis. The report, dubbed Hepatitis, is at par with the mortality rates of malaria, HIV and tuberculosis. On the other hand, non-alcoholic fatty liver diseases, NAFLD, or metabolic liver syndrome, is another chronic liver condition globally with a prevalence percentage of 24% in India. Study results. With the aim to control the rising number of liver conditions, several studies and research have been conducted by both government and private institutions to visualize the epidemiology of the liver condition. In one such study conducted by Amrapurkar et al., the prevalence of NAFLD was found to be associated with diabetes mellitus, obesity, and hyperinsulinemia, with their increased incidences in the last 2 decades in India. The study, consisting of 1,168 subjects out of 730 subjects above the age of 20 years, 341 male, 384 female, and a mean age of 39.08 plus or minus 12.3 years, out of which 4% had diabetes, 57% had central obesity. The prevalence of NAFLD based on the ultrasound was reported as 18.9%. Meanwhile, another study based on the risk of NAFLD in diabetic patients showed that the prevalence of the disease was higher in females, 60%, than in males, 54.3%. Meanwhile, T2DM patients with the prevalence of NAFLD varies from 44.1% in Western India to 72.4% in northern states. In the study, the prevalence of risk increased with increasing age, with the age group 61 to 70 having the highest risk. While on the other hand, to determine the effect of lack of sanitation and hygiene in rural areas, a review aimed to study the viral caseload in the Indian rural scenario was conducted. 1,034 subjects, including adults and children, showed that viral hepatitis in India follows a pattern seen in many other regions of the world. Whereas hepatitis A is rarely noticed in adults, hepatitis B and C infections are responsible for causing both acute and chronic liver diseases in sizable proportions of patients. Hepatitis E causes acute manifestation, whereas HDV infection remains to be a rare entity in this country. Challenges. Even after detecting the epidemiology and a high prevalence rate, there are multiple challenges in treating liver conditions. Lack of validated in vivo and in vitro models, biomarkers and diagnostic challenge, absence of antiviral medication and preventive measures to check the spread of communicable disease, lack of market probation and increasing self-medication. Initiatives. However, certain novel approaches to better understand the pathophysiology have been designed, such as Murine-Nash models, etc. On the government front, the expanding population and increased life expectancy of citizens have encouraged the adoption of several response strategies in India, such as in 2018, the National Viral Hepatitis Control Program was launched on the occasion of World Hepatitis Day, comprising both preventive, vaccination, blood safety, and early detection, linkage to care, screening at risk population, provision of drug surveillance of CLD strategies. Similarly, in 2021, a national NAFLD control program was initiated that integrates liver disease control into other non-communicable diseases control program.